Hey, what's up, guys? Dr. Robert Fredrickson here with the Fredrickson Health Show. Today we have the MSK Wizard, Dr. John Cybulski. He is a practitioner out in Central Texas, and he also runs or co-runs the Anatomy Therapy podcast. So today we're going to pick his brain. We're going to try to be real concise in one subject because I know we could talk about a lot on the human body. But Dr. Cybulski is an absolute wizard, and hopefully he can help me get my hamstrings a little bit less tight, as I call it, quotation marks, tight. So Dr. Cybulski, thank you so much for coming on today.
Yeah, man, it's a pleasure. It's just good to catch up with you. I'm excited about your new podcast and all the videos I see often, man. It's really excited to be on and be a part of it.
I appreciate it, man. I'm just trying to keep up with you.
That's why I have a partner, because I can't do it all on my own. My partner, Bobby Riley, used to work for the same company as us way back in the day. I need a partner to keep me going, man. So kudos to you.
I appreciate it. Oh, hey, let's go ahead and let's talk about that. So you met Dr. Riley. I didn't know he worked for Rosti.
Yeah, he worked for Rosti back in the day. Then he left and went to Iceland. His wife had a very successful travel blog. Kind of took off haphazardly, and now it's like almost a part-time job for her. She's a chiropractor as well. So yeah, they live in Iceland, and we caught up. We always kind of, same with you. I'll have other doctors that I've worked with that'll shoot me messages and ask me questions, and we'll go back and forth about things like tight hamstrings. And he and I have kept up over the years, and he was like, you know what? Instead of just messaging back and forth, maybe we should start this podcast. And I was like, all right. And so now our text messages are on a podcast.
I love that. Just letting the world know or get inside your deep knowledge base. I love it. So I listen to your podcast all the time. I always learn a nugget or two. There's always new stuff to learn. So I love those conversations. And I was wondering how that worked, how you guys thought of the podcast. Can you go into more of hey, we need to get this live. We need to get more people on board with this. Is it more for practitioners? Is it more for the general public?
Yeah, we've kind of struggled with that because we like to just BS together, and it's more for us initially. Because if you don't love it, then the people will know that you don't love it. But it tends to be more so for doctors, practitioners, physical therapists, physios. Since Bobby's over there, we actually have a good European following. So nice. You have to start considering what the physios think, which is a little bit more how you and I kind of practiced back in the day. The company we work for is still a little bit ahead of their time in doing a lot of manual therapy. So I was kind of lucky to kind of bridge those things. But yeah, we just have a conversation about, usually it's what interests us that week. If we had an interesting case that week, and then we've slowly gotten better at refining things. As you kind of pointed out earlier, it's just good to keep it on one topic and go ahead. As you can tell, I'm all over the place. So. But yeah, it's just what interests us that week. Yeah.
That's awesome. Yeah. Well, cool. I want to get into muscle tightness. I want to talk about just for people who have chronically tight muscles, soft tissues, etc. And I know a lot of the factors that are contributing to my tightness, but if you didn't know me and I told you, hey doc, my hamstrings are tight, I stretch them every day, or maybe I don't, I gave up. What's going on there? What are some common issues with that you see in your practice?
Yeah, I mean, again, it's going to kind of depend on a good history. Are you an ex-athlete? What are your activity levels now is what I'm kind of thinking initially. What makes you say they're tight? How is it that you even notice that they're tight? Are you bending down to deadlift? Is that why you notice they're tight? Or is it tough to tie your shoes? So I'm trying to look at those more active lifestyle things to hopefully meet you where you need to go, if that makes any sense.
Makes perfect sense. And we know that a lot of the tension in the hamstrings aren't really the hamstrings, right? There's so many other variables, components, as you always for the wizard in finding out, maybe it's a dysfunctional sling pattern, maybe it's the hip flexor, maybe the lumbo pelvis is dysfunctional. Right. Can we kind of go into that a little bit for hamstring tightness and maybe a quad dominance? What would you look for those imbalances?
Yeah, absolutely. I mean, there's always the push-pull in the body. So those hamstrings are kind of a secondary slow mover. So they're tied to some pretty big muscles, they're near the glutes, they're opposite of the quads. And then, of course, the hip flexors are going to counter those hip extensors. So anytime there's a push, there's a pull in the body. And if you're only feeling it in one area, oftentimes you check the opposite side, you can notice those imbalances. Some imbalances the patient or your client will sense, but then there's others that they don't sense. And those are almost the more dangerous ones. So I'm just thinking about push and pull in the body, especially with those hamstrings. So and here's the other thing. Well, with your hamstring, is it one hamstring or is it both?
It's both.
Oh, geez, man.
My theory is I'm wound tight. I'm wound tight.
Yeah.
Always been tight.
Yep.
Or felt tight.
Yep.
I pull muscles very easily. I always have. I've been fast. I think I have fast twitch muscle fibers. I mean, I used to maybe anyways, but I just pull things really easy.
Yeah.
Too easy almost. So.
Like, I don't think there's a problem too with tension as well. Like, I know that, in our world, mobility is kind of the key. Everybody wants to be mobile and flexible, but a lot of that tension can produce, like you said, speed and athleticism. So sometimes if you are tense and you, as a doctor, or you want to take some of that away, you almost can take away some of the athletic capability of a person as well. So, that's why I'd ask, like, why is that tension a bad thing? Like, if you're a track athlete and you can get out of those blocks real quick, then that's awesome.
Right.
So, like, why is that tension a problem is where I'm going at first.
I say for now it's a problem because when I run, I'm too tight. Like I'm not stopping because I'm like fatigued. Cardiorespiratory fitness is fine, but my muscles feel like literally if I keep going, I feel like I might tear something when I walk or get in and out of my car the next day. So
do you feel like maybe like the resting level of where your muscles, like a muscle should contract and relax, right? And if there is kind of a spectrum from contract to relax, that your neutral is more towards that contract side?
I would say that. I would say it's probably weak. I say my body's probably getting tight.
Sure.
Compensate for a weakness. I don't know. I'm just tight all the time.
You're just yeah. And that's fine. Yeah. So, I mean, like one of the things that I would like immediately do, and it's a very kind of well studied exercise, are kind of these step down exercises where you a lot of people will do it on a slant board, but people sometimes will do it off a step. You'll step to the side, but this one is kind of stepping forward, almost letting your knee go forward, and it's overloading the quads.
Okay.
And typically it teaches you runners when they have knee pain, will step forward and you'll feel the knee or the patella starting to hurt there. But what you do is learn to keep your chest back, disengaging your hip flexors, and you start to feel the middle of the quad kind of working, which is, there's a difference between quad dominance and just using your quads appropriately. So like a lot of the quad problem is the quads and the hip flexors are working together. But if you could get those quads and hip flexors working alternately, then you got some money. But basically those step forwards is one foot is going and one foot is kind of stepping forward and down. So you're just learning to contract and feel your quad, which is opposite of the hamstring. Nice.
I love that little pearl there. Is that I've heard you talk about this in one of your previous podcasts about like referencing the knees over toes guy. Is that kind of one of his premises or one of his concepts?
Yeah, I mean, it's a really well-studied exercise, but because in the very beginning of the exercise, people will feel their knee pain a little bit, people start to back off and have kind of thrown the exercise away. But yeah, he's an active proponent of building in some load and tolerance. So, and this is, I'm sure you've encountered this with your workouts or whatever, things start to hurt a little bit, right? But if that pain isn't the same as neurologic, progressively worsening symptoms, then ride that pain wave. You know what I mean? Right. Sometimes things just hurt, like when you're talking about running. Oh man, like it feels like it's going to snap. That's progressive. Let's stop there. But there are those people who are like, oh, I had a workout and it hurt so bad. What do you mean by hurt? You know, where your muscle is just burning from, doing a bunch of reps. That's a good hurt. You know what I mean?
Right.
And so that's why this exercise can be very tricky. If you can kind of go into the hurt and find that it's actually not going to do anything horrible to you, then it's actually very beneficial.
Right. I love that. So I want to talk just a little bit about length, tension relationships, what you think about that. And sorry, I'm going to backtrack. Yeah, you made perfect sense. My mentor in chiropractic school, he treats a lot of professional athletes, and he told me, he's like, Robert, like sometimes you don't stretch people that have a lot of tightness because this athlete, like he did all like the best things he knew. He worked on it for 45 minutes. Normally his treatments were like 20 minutes, but he's like, I went double time on the mobility and all their soft tissue work. And they did like considerably worse than like their 400-meter race. Like he's like, that was eye-opening to him. It's eye-opening to me. It's like, okay, so maybe we got to put the sport at hand. We got to put the goals in mind and figure out, hey, sometimes we need some tension. We need to just, get warmed up dynamically as much as we can without, losing some of the fundamental strength that makes us a good athlete. So that was a pretty cool story that he told me. And I was like, okay.
Awesome. Yeah, no, yeah. I totally agree. That's perfect.
And I've been guilty of it too. And I've had CrossFit athletes and I've given them all this stuff. And then on that, I guess that open workout or whatever, I'm like, hey, like, let's just back down. Let's just do some easy stuff. We don't want to stretch too much and then, inhibit any of that, performance benefits that you're trying to get. So,
yeah, absolutely. I mean, it's the same thing that ultimately, patients will ask you, when do I do these stretches? Do I do them in the morning? Do I at night, during my workout, the middle of my workout, after my workout? And I think one of the main things is, warming up nice and easy before, getting the blood flow, and then after the workout, getting a good stretch session in. And that's kind of the safest approach. You can definitely stretch before, but I've definitely noticed it being much safer if you can do it after the fact.
Right. So length tension relationships. Let's talk about that a little bit. And how do we make fundamental, long-lasting change with our stretches? I mean, what have you found to be beneficial and effective?
So I actually want to hear your answer on this one. You're throwing all the tough ones for me today, boss.
Sorry.
No, it's okay. I love it. So like long-term changes, I mean, sometimes are going to take either a lot of time or a lot of tension, right? That's kind of working out. That's how muscles adapt, time under tension. Mm-hmm. So you can either do it a little bit of tension for a lot of time,
right,
or add more tension for a shorter period of time. Again, that's going to go back to what it is people are looking for. And what specifically do you mean by length tension relationship? Does that make sense?
I mean, I just feel like some people just have maybe anatomical differences. Maybe their hips are a little bit different. Maybe they're retroverted, anteverted hip.
Right.
They squat different. We can't put everyone in one box where they all squat the same. But maybe someone does have more of an anterior pelvic tilt. They have extended hamstring length, and maybe that's me. I think it is me a little bit, and maybe that's why I'm always chronically tight, but it does give me some benefits in other ways, but negative in others too. So I just want to see, you're so smart in all this. I just want to see your thoughts.
No, absolutely. I do agree, like that lumbo pelvic complex. So whenever you have an anterior pelvic tilt, I think J-Lo booty, right? Mm-hmm. Kind of sticking the butt out. That is going to increase the length of that hamstring. Right. So the insertion point moves north, basically. The quads are shortened, the hip flexors are shortened, which is where we were talking about kind of getting the hip flexors and quads to disassociate. What I'm really saying is put your pelvis in a better position. Now you can use your quads and your hip flexors to control that position, but that will then indirectly put those hamstrings into a better spot by kind of posterior tilting your pelvis. But that's why going after things like the hip flexors or the quads are better, because sometimes those muscles are a little bit tighter, a little bit stronger. And sometimes directly going after the hamstring is a little bit tougher versus getting the pelvic tilt right via the quads or the hip flexors.
Right. So what are I haven't talked to you in I guess sometime directly, but what are some of your like maybe go-to hip flexor stretches, glute medius exercises that you started off doing? Maybe you've changed since you initially started. What have you found to be kind of the most effective at this point in time?
Yeah. And I mean, this is something I give to almost all of my patients. And it's just a good measure. Just the wall stretch, the couch stretch, where it's kind of, it's like you're taking a knee back in the day, but you put that back leg up onto a wall or onto a couch. So it's like a quad stretch. The knee is fully flexed and you're stretching out that hip flexor. I like the wall to block you there with the foot kind of up into plantar pointed flexion, just to lock absolutely everything up and almost come down from a hands on the ground position to try to then pull your body up and rip that hip flexor open. That's my go-to, man. I give that to so many people. It's so good. I know what's your favorite, first of all, before I go to my next one?
Mine's a couch stretch. Yeah. Same one. When I first started in CrossFit, in chiropractic school, I looked like an idiot. I mean, I could not even get close to I had to use like boxes, build up the boxes. Now I can do it pretty easy, but I still sometimes have to grab the foam roller, some support. But I'm very tight. I've always been a tight guy, but I've come a long ways, and that's one of my go-to stretches. And how long do you have your patients hold it? I know there's some differences in opinion there.
I want them, this is my time, because the tension is kind of going to be flat and whatever it is in that kind of static stretch. And there are some people that will kind of bounce their hips forward or kind of twist their arms or just kind of sit there. I like to give my patients less information. I'm just like, you need to stay there for about 3 minutes, because they'll get there and they'll start sweating. And I'm just saying at least 3 minutes of just sweating and trying to breathe and relax there. So that's just letting that time and tension feel a bit more normal and natural. So 3 minutes, but then it's also a good measure of your how you're progressing or not progressing. People will be like, oh, my back is still hurting. And I'll say, how's that stretch? And they're like, ugh, I got some work to do. And I'm like, okay, then, so
Right. And for anyone who's maybe like not even tried this, maybe they're a beginner, was there anything you make them do before that? Any kind of, I don't know, with crossball work, foam roller work before they even go to the couch stretch, or do you have them just go straight to the couch stretch?
Oh, I get them straight into that sucker.
Nice.
Sometimes I won't have them go all the way up. I'll put a chair in front of them so that they can kind of put their hands on the chair and kind of push themselves up a little bit. Some people, I'll just have them down almost in the 3-point position, where basically, they're down there, down set hut, and they're just going to stay down there and they can slowly work their way up. I'm fine with that. I'm totally fine with that.
Nice. And
go ahead.
I was just going to say, so 3 minutes, Kelly Starrett, I heard a long time because it takes 2 minutes to make actual physical changes in the soft tissue anatomy. So are you under that premise as well? Is that why you have them go a little bit longer, that 3 minutes, to make sure they're actually making changes that last?
Yeah, absolutely. I just want them to know they're in it for the long haul and just to get comfy there. But yeah, to cover that, because then they're going to squirm around a little bit, like you've done it, and it takes a second to kind of settle down. So I don't know when the 2-minute clock officially starts. So 3 minutes is my safe marker.
I love it. And so do you do it every day, or just when they are working out? You prescribe
every day,
every single day.
Especially for a patient that's hurting, and definitely after a good workout. I think a lot of people take their workout home with them rather than take the workout and then stretch, try to get your normal body back, and then cool down and go home.
That's a good point. I'm guilty of that. I'm like, oh, I just got done with the workout. I need to get home. I'll go stretch later. That later usually never happens.
Absolutely. That later happens the next morning when you wake up and they're like, oh man, I'm hurting. And then they go, oh, do I need a new bed? Or is my pillow killing me? Hey man, it's because you forgot to do stuff last night. It's like blaming the highway for running out of gas. That's not
right.
You're just, you should have filled up way back there.
Right. I love that. All right. I'm going to definitely link to the couch stretch for anyone listening here. So what's your next stretch, or your next mobility or stability tip?
Yeah, so I would actually jump through, and I've kind of posted this actually recently. It's kind of an old school one from back in the day. When you used to walk down the field and kick your foot up real high across the body?
I saw that. Yeah. Yep.
Dude, this is the elasticity. So there's a famous quote: if your muscles are not elastic, they'll become plastic.
Ooh, I like that.
Right? It rhymes. You can't forget it now.
Can't forget it.
Your muscles' ability to stretch and relax. And so those kicking ones, allow that long tension relationship, which is what you're doing when you're running. Mm-hmm. You want them to be bouncy and elastic, and it's not hard. It's under a controlled setting, and you can kind of build in some of that space and elasticity over a repeated period of time. So I'll try to get 100 of those done per leg during my workouts.
100
per leg. So
just
this is
my time.
If
you're doing a lower body split, or you do it every day?
No, I'll do it 3 times a week. Yeah. Usually with my lower body. Sometimes I'll mix, if I'm doing upper body, I'll mix in the lower body. Just kind of, it's my rest between sets. And so this is the thing with those kicks. If you're kicking the leg way up, the tension might be really high in your hamstring, but the time is very quick. So I need to do 100 of those to accumulate some time with that quick kick tension.
I love it. And what's the other move that you posted about? You did the forward hamstring swing, and you did the backwards kind of leg
Kind of
flip kick.
butt whip
Yeah.
kicks. Yeah. So, and that has to do with your ability. So your hamstring lengthens and it also contracts. The thing it also does is help get that pelvis. You want your hamstring flexible in flexion and extension, right? Because hamstring is
Okay.
one of the weird muscles that crosses two joints. It goes pelvic, femur, femoral, down through the tibia as well. So it's a kind of a complicated muscle there. Is your hamstring more of a distal or proximal problem? Well, I make sure to go both ends.
Nice. I love that. That's awesome. So you've been doing that for yourself now recently for how long?
So, I mean, only about a month now, but you can really tell a difference, man. It's very taxing. I'd be interested to see. Let me know once you try it how good it is. But like, it's very taxing. But then afterwards, you're like, I'm all wobbly bobbly. It's wonderful, man.
That's awesome. All right, I'm gonna start doing that. Yeah, because I did only do about 20 hamstring swings. Beginning of a workout. A lot of
Yeah.
CrossFit boxes will do that as part of the dynamic kind of type warm up. But we
Mhm.
didn't do the kicks or the leg whips. We might do some butt kicks, but the whip is a little bit more intense, and it looks awesome. It looks awesome. So
It's intense, but yeah, I think here's the other idea in terms of your muscle being very contracted, kind of in
mhm.
a tight state. Sometimes you could almost, it's usually the kind of athletes that are like, I got to go do CrossFit. I need to go do CrossFit. I feel I'm really tense. CrossFit is like my meditation. You know what I mean? I'm not a meditator. I can go work out and burn it out. So sometimes if those muscles are very tense and you make them more tense, they'll finally just go and relax. Does that make
Right.
sense? Kind of
Yeah.
the same thing as a good CrossFit workout where you're like, oh, I needed that. That was a good relief. So it's the same thing with the heel whip where you're just going to contract it all the way just till it kind of burns out.
So that's kind of getting like kind of neurological, getting past that, you're sensitive, and you do it over and over again. So you're not as sensitive and you're less sensitive. And then eventually you don't have those tension receptors, maybe the Golgi tendon organs, in your tendons that aren't, let's say, okay, we give up. You're going to do this to me every single day. We're not going to be tight anymore. We're safe now. We don't have to be guarded. So
Precisely. I think that has to do with like the foam rolling too. That's one of the secrets of foam rolling, I think. Do you still have your people foam roller?
I love the foam roller, and
Yeah.
there's a lot of controversy over what it's actually doing. Right? I mean, is it breaking up tissue? Is it breaking up fascia? That's kind of been debunked, but I know I see results, patients see results, everyone I prescribe it sees a benefit. And so, yeah, I want to see your thoughts on foam rolling.
Yeah, the same thing. I think people are like, and look, the people that are arguing about it are also kind of like higher level clinicians. Is really not patients being like, this has not been effective for me. And really, it's people arguing over what is the logistics of what's happening. Are the beta fibers over dominating the theta and alpha neural? You're like, hey, do you feel better? Okay,
Right.
great. Keep doing it. You know what I mean? Maybe we haven't exactly figured out what specifically is happening, but that's okay as long as those benefits are, positive.
Exactly.
That's my take.
Yeah.
But I
And
think you said it perfectly in terms of the Golgi tendons being less sensitive. It is just wearing down that sensitivity, building tissue tolerance. That's what working out is, just on a different level.
right. Exactly. Yeah. So, everyone's like, well, you shouldn't foam roll your IT bands. It takes 10,000 pounds of force, to break this apart. But I'm like, yeah, but after I foam roll, I don't know. I'm not as tight there. I can touch there. I'm not as sensitive. My calves, when I foam roll, I just feel like I get better blood flow to them. That makes my other stretches more effective. I love foam rolling. I think there's benefits there. I heard a podcast and I read a kind of a paper on, I don't know if you've read this or not, about hyaluronic acid being kind of in this collagen bound matrix, and then how foam rolling can actually like break down some of that unbound water, make it more bound, and kind of change the collagen tissues a little bit over time. So that
I'll
was
take it.
on the cellular level. Yeah, something's happening. We know
I'll
that.
take it. I mean, especially I think for just your general population, it's an easy modality that, that just works. I mean, I do think one of the other arguments is that there comes a time when maybe foam rolling, you can surpass it. I remember when I first started being a chiropractor, I foam rolled every day. And then there was a point in time I needed to get a PVC pipe to foam roll. I'm sure you know guys who use a PVC pipe.
Yeah, yeah.
And I outgrew the PVC pipe. So, I mean, it's just a part of a progression, but I do think it's a great starting place for like most people out there.
Right. And then it goes to PVC pipe, then it's to the barbell, then it's to the barbell smashing.
Yeah.
On the quads.
Do you do the barbell smashing? I mean, that's some good K-Star stuff. I was like, I think I'm good at this point.
I did. One of our CrossFit owners made us do it, and I did. And I would never prescribe it to patients, right? Because I was like, this is way too intense for like what we're dealing with for your low back pain.
Yeah.
But, I did it yesterday just because I had the bar resting. I was doing some pelvic thrusts. I had the bar there. I was like, okay, I'm just going to see what happens. And it still hurt.
Yeah. I like it on my tricep. I've been very few, like, I don't know how to, foam rolling doesn't really work on my tricep because I can't get enough tension on it. But I do think I like that barbell on my tricep. That's like the only place. Other than that, I'm like, I'm good. I'm okay. That's tough.
I like it for thoracic mobility. I like it for calves, a quick hamstring rollout, quads. I really haven't foam rolled as meticulously as I once did, but it's still in my arsenal. It still sits there. So
absolutely. No, it's good. I love it.
Yeah. Okay. So I know there's a big kind of emphasis on like functional range conditioning, like controlling the range of motion. And have you played around with this yet? Have you seen any benefits with your patients versus static stretching?
Yeah, I mean, I honestly don't use it too much with my patients. It's just an interesting way that I've thought about perhaps kind of assessing people.
Okay.
It's just kind of a different way to look at how joints move all together. So you're talking about the FRC and Dr. Andrea Spina, the functional range fitness. They've got a couple different people where they'll do an assessment and then they do kind of the rehab portion. They also have a really detailed like manual therapy portion.
Oh, okay.
So yeah, so they're chiros, they're Canadian chiros, so they're weird. But God bless. But yeah, so they look at the joint a little bit differently than say like, let's just say your traditional American chiropractor would. They're just looking at how far it moves. So like say they talk about a joint kind of circle, right? Like if you moved your arm back around and went into an entire circle, you would notice that circle wasn't a perfect circle most likely. And that there would be little hitches in the giddy up of your circle. And that those little places were points through your range of motion that were not full and complete. And the way to address that would to go and find those ranges that you lacked in essentially. So the only place I use it with my patients is kind of small joints and the neck. So like if you just did a neck, like kind of a big circle, there would be points through that neck where they would be like, oh, it kind of pops, it kind of hurts. But the idea is if the movement is controlled, if there's controlled tension, then you can kind of slowly open up that circle, open up your range of motion very slowly. The one thing I don't like about it is they take forever. And so I want to get people better yesterday. And so some of this stuff you're doing it for weeks and weeks on end. So it's one of the reasons why I don't really use it with patients. It just takes forever. But it's something good I like to give patients like at the end of this. I'm like, hey, we're discharging you. It's time to go. But I need you to move your neck in a big circle every morning. Just warm it up, get it moving through that entire range just to prep your muscles and joints.
Right, because you get patients better fast, 3-4 visits, very quickly. And yeah, I think me and you are both on the same page. We like to do the things that are the minimum effective dose, getting people better as quick as possible, in the most effective manner. So maybe it's, hey, let's give you the biggest bang for your buck exercises like the couch stretch. Yep. What other stretches, going back to that, what other stretches?
Yeah. So you asked me about a glute stretch for sure. And there's one, so a lot of people call it the pigeon stretch. Mm-hmm. But I do it a little bit differently, obviously. I wouldn't do it normally, like a normal person.
Right.
Okay, so in terms of the pigeon, when people do it, they'll put one leg kind of an external rotation, right? And then that back leg kind of goes back. Now, say your right leg is kind of perpendicular, right? That's the leg in front. Uh-huh. The left leg typically goes back into the left. Now, I don't like that. I like the leg to go back into the right because you're trying to stretch out the right hip. And I call that back leg kind of the rudder. And so if you see people doing the pigeon, they're stretching out the hip, but as that other leg is going away from the body, it's shifting your weight out of that hip that's forward. So it makes absolutely no sense. So whatever that hip is forward, say your right hip is down, that back leg needs to go back into the right as much as possible so you can shift weight back into that hip. So it's a pigeon, but you're going the correct way, I think. Does that make sense?
Yeah, that makes sense. Just a small little tweak there. That's why you're the musculoskeletal wizard. Okay.
You
Any
shall
other
not
stretch?
pass.
Yeah.
Yeah.
So going minimal effective dose. We got the couch
Absolutely.
stretch, pigeon stretch. Any other stretches, mobility you'd add?
Yeah. So any kind of a groin,
Leg whips.
big leg whips. Oh yeah, the leg whips and the leg kicks are awesome. I think one of the big overlooked parts of the hip is the groin. People, for whatever reason, ignore the groin. I know you don't, but there are a lot of people who will just work the hip flexor and maybe give a little bit of a stretch to the groin. The groin, there's a lot of hip all through the inside of there. And so I like kind of the NHL hockey kind of rock back one. You're on one knee and one leg is out, and then you kind of shift back
Yes.
and rock into the hip. I love that one. I love, I think groin stretches or groin exercises are widely missed in our field.
Why do you think that is?
It's just a smaller group of muscles. I don't think people complain about it as much, but I think if you ever, palpated or did some manual therapy, you would find some problems through the groin. It's just not a very fancy muscle group either.
Yeah, and I think it's more of a sensitive area. So sometimes as clinicians, we're like, we need to stretch there. We're not going to palpate there, right, for obvious reasons. But
Sure.
But
yeah, but it extends all the way down to the
right.
knee. You know what I mean? So you don't have to be all up in someone's pubic symphysis to get them some relief. But I do think a lot of groin stretches are kind of missing. If for your CrossFit people, I would say a Cossack squat.
Explain that a little bit.
Yeah. So imagine just like a groin stretch, right? So let's just have your feet are super wide. You're holding a kettlebell typically in front of your chest. You shift your weight over to the left, let's say. So your right leg will be straight. You're kind of bending on the left. And it's almost like a one-legged squat down into the side while one leg is split out, right?
Okay. Yes. Yep.
And so that's kind of a Cossack squat. The Cossack dance, I guess the Russians do, is that when they stay down there and they shift from side to side at the bottom of that squat. So imagine you're in a one-legged squat, but one leg is way out to the side. And then you try to stay as low as you can and switch to the other side. Oh man, that'll rip open your groin something fierce.
Yeah, so that's not the beginner move, right? Yeah, so that's
no, sir.
Ease into that for sure. And I have played around with it. My hips are too tight. I mean, I can do it sometimes with the kettlebell. If I have some weight behind me, I can get into it, but I don't look as graceful as the other people.
I like to get, one of those big green bands. If you're in a box, you're in a CrossFit box, get one of those big green bands tied up to a rack and just hold on it and let it kind of pull you back. So you can kind of sit back and you can have that pull you forward. And then, shift left and right, and then you can slowly get a little lower as you go. But one of those big green bands usually is a pretty good counterbalance to help kind of beginners with that one, I would say.
So for your leg that's extended, is your heel going to be up, or do you have that foot planted as well?
I think people that would be strict would be like, oh, those feet stay planted the whole time.
Sure.
But,
okay.
Let it go up. It's not a big deal.
Right. Okay. Yeah. So adductors, I mean, they tie into the hamstrings, of course, right? So that's a big thing that I probably need to start working on more, but a lot of people haven't heard of that. They don't think about that. They don't think that that's going to have any issues probably with their hamstrings, and they probably should. So.
Well, you don't feel unless you don't feel it, then it's not a problem. I'm sure you work on people's hip flexors and they're like, doesn't hurt there. What are we doing with the hip flexors?
Right. But yeah, usually if you're feeling the hip flexors on the psoas, iliacus, they're going to feel something, especially if they have that.
Their symptoms, they're not feeling their symptoms there. They're like, my back hurts.
Oh yeah. That's almost normal. Like I'm already like, yeah, you're not going to feel any pain there until I touch it. Then you're going to be like, oh man. Okay.
100%.
I'm like sweating thinking about getting my psoas treated. Golly.
Oh, no thanks.
Every time.
That's why I'm doing the couch stretch.
That's why I do the couch stretch. So if I have to get it treated, then I will at least be a little bit more desensitized to that for sure. Okay. So I think we nailed a lot of the mobility exercises. What are some strengthening, stability type work that you're going to prescribe for someone with some hamstring imbalances?
Yeah, I mean, like, so some straight leg deadlifts are probably where I'm going to start off with, pretty lightweight. Maybe we'll go to some one-legged deadlifts if you're advanced or have an athletic background. But that's kind of the slow, and hamstrings respond really well to the eccentric. So, going up and down really nice and slow. And I like to tie it in with the rest of the body movement.
Sure. Right. What do you think about Nordic naturals?
Nordic naturals are awesome, man. People have such a hard time doing them. If you can, find a place where you can kind of trap your heels under, right? Or a buddy who's going to hold them down. The other thing I've noticed that's tough with Nordic is that they take a long time to get better at. And so I think for someone like you, who's like, let's make this a mobility project. This 3 months, I'm going to work on my hamstrings for the next 3 months. Work on your Nordic naturals. Again, going back to like how I think about it with patients, I want you in and out and, done. And so Nordics it's a great investment in the long term. For the short term, they're so hard to do, man. I mean, I don't know when was the last time you did some Nordics?
I tried yesterday.
Oh yeah.
Literally, I was like putting weights on my calves. I was like doing all these things, and
It's hard.
Like it's like the compliance. It's hard to get in that position. No one was home. I couldn't have my wife like grab me or anything. So I was like, okay,
Yeah.
I'm just gonna do like a half Nordic, modified Nordic.
Yeah. It's hard.
Controlled. Yeah, very hard.
But if you got, a little bit of weight and you did some slow kind of deadlifts up and down, you would definitely feel your hamstrings a little bit more there. So just compliance wise, ease wise, yeah, if you're sold out and you're like, I'm going to get my hamstrings, I'm going to spend 6 months on my hamstrings. Man, it's funny. There was a video the other day of James Harrison, the Steelers linebacker from way back in the day. I'm sure you've seen him.
Oh yeah.
Monster of a beast of a man. Yeah. Still works out. He's like, I don't know. He's older now, but he's still working out. And he had someone doing Nordic negative, right? And so he went down and he literally started to lift the guy up that was holding him because he couldn't come back up. If James Harrison can't do them, then I'm going to let you pass on your Nordic negative.
Oh, thank you, Dr. Cybulski. Yeah, I think I was calling like Nordic naturals. I think I was calling it the fish oil. It's not that. It's the Nordic negative, guys.
Yeah.
Excuse my French.
Fish oil is valuable for musculoskeletal injuries as well. I don't know nearly as much nutrition as you do, so I'll let you take that one. But
my mind was just saying Nordic naturals because I talk about that all the time. And I was like, no, we're not talking about that. We're talking about the exercise. It's not Nordic naturals. It's the Nordic negative.
Got it.
So
well, I do think I love by the way, your nutrition stuff is awesome, man. I wish I could spend a little bit more time to study and focus on it, but I really loved hearing all your nutrition stuff.
I appreciate it, man. I've always loved nutrition. I just never had like the time, right? Because we were so focused on the hour with our patients, we couldn't dive into nutrition because it wasn't part of the model. So it's fun to get out there and study. There's so much stuff in nutrition.
Oh, I bet.
As the rehab world as well. So always new emerging science and research. But so yeah, Nordic negatives. If you can't do that, what would be another, I guess, exercise? Maybe glute medius. Do you tie in those a lot? I know you do. But,
Sure. Yeah, no, of course. Yeah, anything to get that lateral hip. So like, yeah, opening up the groin. I like kind of the actually a friend of mine, get one of those big balls, Swiss balls. If you're an athlete, you can get a medicine ball, pin it to the side of the wall. So stand next to the wall, you lift one leg up to about 90 degrees, the other leg's on the ground, and that other knee is pushing that ball and pinning it into the wall. If you don't have a ball, you can just push your knee into the wall.
Mm-hmm.
So it's almost like a march and you push your knee out. I like the ball because it gives a little bit of a kickback and resistance. And you also have a little bit to kind of hold up because that ball will fall. In other words, if it's a medicine ball, you really got to push that knee out into the wall. And that other leg is just kind of in an athletic stance, so just a little bit bent as you hold that ball into the wall. And man, it'll light up the outside of your glute real fast.
Sounds like it. I'm gonna have to try that. Yeah, for sure.
That's a real fun one.
Yeah.
What do you use for your glute medius?
I'm like the lateral hip abduction on the ground to
Yeah.
fatigue, back forth, lateral, backwards, circles,
Yeah.
circumduction, glute. I love monster walks. I do monster walks routinely all the
Awesome.
time.
Yeah.
Step ups, step downs, basic
Yeah.
stuff. Yeah.
No, that's not big. That's essential stuff. I would call it, honestly.
Foundational, essential. Yes.
Foundational. I figured you knew the foundational stuff, and I'm going to try to give a little bit of a next level. I think all that stuff is awesome, and especially you got to find out, like, a lot of the patients, I'm not giving them a ball to stick on the wall just because they're going to fall over and break their neck. So
Right.
we're going to do a lot of clamps to start with. Sometimes we'll put clamps with their back to the wall. I like clams recently with their feet on the wall.
Okay.
So that's just a fun little tidbit. If they can keep their foot, you'll see people's foot start to come off the wall. So they're using their foot to get their hip mobility. But if you can keep that foot planted on the wall or on the ground, like in life, then
Right.
you can see how much of that hip you actually move.
Love it. Love those tips. Yeah, I've been so if it's a runner maybe and I know they have a weak glute med, I can tell on their gaits that they're collapsing on every time they take a step or they're landing on that foot. I might do like the runner's pose, have them on the wall with one hip, engaging that glute,
Yeah.
contracting, relaxing. I might do that with them,
Nice.
but I just try to make it relative to the sports at hand. I think everyone's
Right.
glutes are weak usually.
It's true. It's
Unless
true,
you're
man.
unless you're a tennis player or a pickleball player, you're doing a lot of lateral motions. So
It's very true. Glutes are hard to turn on, man, and hard to keep on. But yeah, that's why, what happens when the foot hits the ground. So I try to as much upright as I can. And plus, generally as well for patients, it depends on what kind of patients you're treating. Are they laying on the ground, or would they prefer to just kind of stand up and just fire some stuff really quick? Your
right.
compliance kind of goes up in that sense as well.
Awesome. So kind of coming into like some longevity aspects, and I just want to I know you have some patients that are coming in and they do everything right, and you've been doing this for 9 years, and you've seen like some of these maybe older patients, I wouldn't say older, but maybe like 50s, 60s, and they do everything right. They have like a minor tweak here and there, but like, what are their secrets? What are they doing to stay healthy in their elder years or older years? Is it stretching every day? Is it having a goal? What have you seen with these patients, and how can we learn from them?
Yeah, absolutely. I mean, I think it's really small things kind of done a lot. I mean, they have little habits that they don't view as a task. They're like, oh man, I got to do my foam rolling today. Like they are excited to take their Nordic naturals. They're excited to drink their water. They're excited to eat their kale greens. You know what I mean? And they're
Right.
little things that just kind of become part of their life. So I would say, in terms of like, making some of these things a habit, start small and then slowly add on until they just start to become normal. Because some people will start and be like, I want to be a marathon runner and I'm going to do my 20-mile run this weekend. And they're like, I can't keep that up. My body's not ready for that. How
Right.
do you eat an elephant? One bite at a time, inch by inch,
Exactly.
life's a cinch. Yard by yard makes it hard. And it rhymes, so you'll remember it. um,
If it's not elastic, it's plastic.
Thank you. I think
There
we're
you
all
go.
learning. But no, but like, set a long-term goal. If it's longevity, like, that's what I'm kind of moving towards with my kind of mobility goals with my kicks and stuff. I'm like, you know what? I've done this for 9 years now. What I'd like to see by the end of this year is that my deadlift is up 50 pounds. I once saw a guy who said, if every week you put an extra 2.5 pound plate on your deadlift, you would increase your deadlift by 100 pounds every year. 50
Si-
something weeks, 2 pounds a week, your
Simple.
deadlift is up 100 pounds.
Yep.
And so that's the principle that I'm kind of sticking with here.
Yeah, and I think you have to fall in love with it too. It's a good thing to have quick success in anything, but you got to fall in love with the process. You got to fall in love with the stretching. Like, stretching is just normal to me. I just do it. I enjoy
Yep.
it. I enjoy waking up not as stiff the next day. And if it's anecdotal or not, I feel better when I do it. And we don't have any. I've looked there. I haven't found it unless you've seen it. I haven't seen any like long-term studies of stretchers versus non-stretchers on, feelings of tightness or anything like
Yeah.
that. But you can just tell. You can tell
Yeah.
people who stick to the process. You work out, you're healthy. They stretch, they warm up, they cool down. They don't wait till they get home. They never do it like I do sometimes.
Yeah.
So you kind of see those people, and I'm like, I want to model after them, because I'm getting to that point. I'm like, look, I don't need to be as fast or as strong or whatever. I have 2 kids. I can have the dad bod. It's fine, or semi-dad bod. But I want to be healthy.
Shape, man. You're
Yeah,
in
I
shape.
just want to be healthy. I just want to be healthy,
Yep.
and I don't want to have pain. And I don't want to preserve my joints. I don't want to be beating at my joints like I was doing in my 20s, with the competitive CrossFit stuff and running stuff. So now I just want to be healthy.
Yeah. But look, I want to ask you real quick. I know, what's your longevity nutritional thing? Like, what's the one thing you wish, guys in their 20s, 30s started to do before? What would you?
Man, just to be simple, it'd probably be magnesium. It's so simple. If you're tight, muscle tension, tightness, and magnesium, not the oxides. So if you need to go to the bathroom, that's the one you would take. There's different forms of magnesium now. So like a mag glycinate is going to be kind of neuroinhibitory, but there's also a magnesium malate. So I take a blend. It's got malate, it's got glycinate, and it's also got a little bit of citrate just to get the elemental form. But I take that supplement every single morning, 2 capsules. And when I get home, I'll take like all the other stuff in my pantry, but the magnesium is the only one on my counter because I think that's the most important one that I need. I think everyone needs magnesium. We just don't get enough from our diet unless you're just pounding almonds all day long.
Yeah.
Right. So
I'm not. Yeah. But I have another question for you. This is a good one for the patient. I have 2 patients like this actually now, and I don't have enough research to combat them. But and how I practice, but these people bruise. Like, I look at them funny and they start bruising. A strong gust of wind comes, the AC turns on in the clinic and they start bruising. Like, these people bruise. And then I started asking them about some other stuff, and they're like, I was like, so what sort of supplements are you taking? They're both very holistic and very healthy. And 4 hours later, they were done telling me the laundry list of things they were taking. And they were saying things like B12, vitamin K, vitamin D, but then they were like, I take a pill for stress and it's all natural. They take a bunch of stuff. I might argue too much.
Okay.
Is that a thing where you're like, you almost overdose with like over natural supplements? What's your take on that?
Yeah, with anything, like, the Google's out there, and you Google hamstring tightness and you find all these different conflicting answers telling me not to foam roll, telling me to foam roll. Same with supplements, same with vitamins. You take all these vitamins because someone else said it was good. And the vitamin industry is crazy. Like, it is filled with a lot of nonsense, a lot of bro science, but there's also some really good reputable companies that are like doing things the right way, getting vitamins like the magnesium thing, like in the right forms that actually get into the cell. So some vitamins, I don't know exactly what brands she was taking, but some like B vitamins, for example, a lot of times they need to be methylated to actually get incorporated into the cell. So there's like the extracellular space, and then there's the intracellular space of red blood cells, et cetera. And omega-3s need to be in there, zinc, magnesium, selenium, just to name a few. They need to be able to get inside the cell, and they need ions. Like, zinc is a positive ion, so it needs kind of like ion phoretics, like quercetin. So they're talking about COVID now with quercetin being able to allow zinc to get into the cells to stop, RNA replication for viruses. So that's there's so many things to go into, and a lot of it's nuanced, but I would say if she has her, tell her to go somewhere someone who can do like some functional medicine testing, like do a nutrient evaluation, say, hey, see what vitamins are actually getting absorbed, what you're deficient in. Right. And that's where you'll be able to like narrow down that list instead of taking everything and just guessing. This one working? No. Then you forget, like, well, I felt better on the vitamin D, but I don't know if I was bruising better. It's so hard to tell, but
so like, she told me that she was taking it, and I was like, well, why do you take that one? She was like, well, it's good for you. And I was like, good for you for what? Like, did you find out you were deficient in that? So that's a good, I'll have to tell her to go get, because vitamin D generally be like, it's good to take a zinc, but if you're deficient in them, anyways. Okay, I'll have to give her
so
that
many
advice.
things. Thanks. But I think vitamin D is this. Vitamin D, getting that tested once a year is, I think, critical. I think a lot of people don't do that enough. And a lot of times you go to like a regular doctor and your levels are above 30. They say, hey, like you're good, you're adequate. But we don't. There's a difference between adequate and optimal. And a lot of practitioners research shows that you need to get levels in the 50 to 60, sometimes even higher than that. You know, some people say like 50 to 80 is the optimal range. And vitamin D and musculoskeletal health is huge. And if your vitamin D's levels are low, you're not going to be functioning the same. Your immune system's going to be off. Your healing is going to be off.
Right.
And so, I don't know. I think some of those ranges, like they need to be updated, like the RDAs, for example. Like you just need a lot more of a lot of these things, but just making sure you don't get rickets or scurvy is kind of how, you know, so the bare minimum for RDAs. And so I don't know. There's so many things we could talk about for that patient.
Yeah. No, that's a good start. I'll have her get tested like a functional medicine doctor. I think that's perfect. I got something. Thanks, man. Jeez.
Yeah, you got it, man. You got it. So anything else for anyone who's got chronically tight hamstrings? And they've been stretching, I guess, what would be your time frame to say, hey, they've been stretching for 6 months, nothing's changed, like
oof.
What, or maybe 3 months. Okay.
If you're stretching for 6 months, we need to talk. I want to see those hamstrings. But yeah, I would look towards the opposite side, the hip flexors or the quads. I've seen a lot. There's plenty of good research to back this up. And I stole this from my buddy, Nick, that your foot and ankle are just going to be often trashed. So sometimes the foot and ankle doesn't move very well. And I would kind of look into doing some perhaps dorsiflexion work, plantar flexion, sitting kind of child's pose. But generally, if you're running and your base is all messed up as well, you're going to have some problems upstream, if you will. It's like someone driving their car and they see that the steering wheel is kind of shaky. And you're like, I got to get a new steering wheel. Maybe, but perhaps those wheels are out of alignment. You know what I mean?
Right. Something is off, and your car's telling you something right now that we need to get this checked out. So that's awesome. Yeah, always look. Yes, I think always look upstream. Always look downstream. Figure out. Go see someone like Dr. Cybulski if you're in Central Texas, and figure out what is going on. He can do a full functional assessment on you. Figure out why you're not. Why you're bruising, why you're not bruising. No, he can figure out a lot.
I'll send them to you for that one. But yeah.
Okay. That sounds
absolutely
good.
But yeah, if you're in San Antonio, come hang out.
Awesome. All right. So anything else we should add to that? I mean,
no,
hip
man.
Flexors, glute medius. Okay.
That's a comprehensive. If anybody still has problems, they need to seek professional help. But no, I think if you give yourself a wider berth to work with. People want things overnight. We live in a drive-through microwave culture. Mm-hmm. You know, give it a little bit of time. Take your speed. And honestly, if you're just persistent and consistent, like kind of like your longevity thing, I think that you're going to be successful. If you're 3 months in, you're pretty consistent with this stuff. Yeah, we got to talk about some PRP and some steroid injections or something. But generally, just the consistency should take care of it.
Right. So last thing on hamstrings. I'm sorry. I want to cover everything. But it seems like softball season, or back when we could play sports, right? Now we're in 2020. But it seems like every softball season, I had so many hamstring pulls. Someone would get a base hit. They would sprint to first base. Ooh, pull the hammy. So if someone's getting ready for softball season, they haven't been active in a long time, maybe they just played golf, should we start doing it 2 months, 3 months? What would you suggest getting warmed up for the sport, training for the sport of life and the sport of recreation?
Yeah, I mean I would go back to those heel whips and those front kicks, because the pulls that they're getting are going from 0 to 100 really fast. You're just here, and then all of a sudden you're like, oh, here we go, And then furthermore, run through the base. I'm not going to tell you how to play run to first base, but a lot of people want to almost stomp on that base. But if you can get prepared for it a month in advance by doing some of those kicks, and maybe do some of those stop-start sprints as well, wouldn't hurt. Then I think you'd be okay.
So we can't just start stretching that morning before the day of and be okay?
Unless you want to come visit me, go see the Fredricksons up. I mean, yeah. Unless you want to come into our office, then I would not suggest that.
Right. Awesome, man. Well, anything that you've learned in this 9 years that maybe you started doing that's kind of changed or evolved, and anything you could add to this conversation today? Or I know you've been good since you came out of the womb, but
I came out in clinical mastery. No, I think I think the message is to kind of slow down and listen to your patients, slow down and listen to your clients. Because a lot of times I think we overcomplicate things. And I know that I kind of have starting off overcomplicating things. And I've got a lot of knowledge and I want to share it all right now. But if I can just wait and find that gap in the patient, and I have to find out what gap that I'm filling for that person, how I can serve that person, how I can serve this podcast, man. You know, what gap can I fill? Because I've got a lot of filling, but I don't know if it's going into the right place. And so it's kind of just, you might not get it from this podcast, but sitting back and shutting up and just seeing where you can best serve the situation. I think that's where I've been the most successful in my career.
Awesome. So just being more present, focusing on what matters and getting down to it. Now, I've asked this question before. I think you kind of would just say the same thing, is if you had to put kind of a 1 or 2 sentences on a billboard for everyone in the world to see, what would that be?
Man, gosh.
Health related.
Health related. I was going to say, call your mom and hug your grandma, but
that's good too. That's good. That's really good.
Yeah, absolutely. Man, health related, I would say consistency. Little things, inch by inch, life's a cinch. Get into the gym 3 times a week, get there 5 times a week, but do it every week. Just make it a habit, keep it consistent.
I love it. And elastic is plastic.
Exactly.
If you're not elastic, you're plastic.
That's it. Get bouncy, baby.
Get bouncy. Awesome. Hey, it's been a pleasure speaking with you today. Please let anyone listening where they can find you, where they can find your podcast, where you're on social, and where they can find you physically.
Yeah, physically, I'm at my house. Don't come here. But I'm also on Instagram at The Anatomy of Therapy, The Anatomy of Therapy podcast on iTunes, on YouTube. But yeah, I practice here in Central Texas for Rosti, down at Oakwell Farms, just south of the airport near Alamo Heights. But yeah, I really appreciate you having me on, man. Today was a blast. I really enjoyed this.
I miss talking to you, man. We got to do it again soon. So
absolutely. Awesome. We'll have to have you on as well, man.
I'd love to. All right, guys. Thanks again for tuning in, and we'll catch you next time. Peace.